world of plastic surgery. I'm Colleen Williams. On this show, our featured plastic surgeon, Dr. Daniel Brauman, will talk about a new approach to eyelid surgery. It's a technique developed by Dr. Brauman and performed at his practice in White Plains. And his patients are seeing results that are not only amazing, but long-lasting.
And I was always trying to look into procedures. What can I do? Botox, fillers, just to help me and, take away the wrinkles and the bags. And nothing really worked. Nothing was permanent like this was. This has been.
The objective is to make them look as the way they looked a couple of passport photos before. All I'm trying to do is restore the appearance to what they used to look like before they started aging.
Stay tuned for this edition of the World of Plastic Surgery. We're joined now by Carlene, one of Dr. Brauman's patients. Carlene, thanks for being here.
Yes, thank you for having me.
Good to see you. You look great.
Thank you.
Tell us a little bit about yourself.
I am a single mom, 38 years old. I own a children's entertainment business. I do birthday parties for kids. And that's pretty much it.
How did you find Dr. Brauman?
I was watching The World of Plastic Surgery.
You were just flipping through the channels?
Yep. A couple times I've caught him at night, and yep, that's how I found him.
Were you already thinking about having plastic surgery when you saw the show?
Yes. At least 2 years I've thought about doing it. And I actually didn't really think that I was going to do it when I was kind of so young, but it really doesn't matter on your age. It really matters how you feel, what bothers you. And most people would say, oh, you really don't need something like that. But to me, it was something that I saw, and it was on my face, and it bothered me, so.
What did you want to fix?
I had bags under my eyes, puffiness, due to allergies, always looking tired. It was something that really bothered me a lot.
And you were actually getting comments from people.
I was getting a lot of comments from people that you look tired, are you sick, are you under the weather, have you been working a lot? And my rest is very important to me, so I was always well rested, so it was just my eyes.
Had you tried face creams or any of those other things?
Absolutely. I've tried face creams. I also tried Botox underneath my eye, fillers, just to help me and take away the wrinkles and the bags. And nothing really worked. Nothing was permanent like this was. This has been.
Talk about meeting Dr. Brauman during that initial consultation.
The first moment I walked in the office, I just had such an amazing feeling. Everybody was warm, comforting. I felt very comfortable. And you could tell he's meticulous with his work, which is very important. He took such a long time to sit with me, to answer my questions. I didn't feel rushed. And it was just a very good experience.
Did you decide right then and there to have surgery?
I did, yeah. I knew that he was the doctor. I didn't have to think about it. I didn't have to go home and think about it. He knew what he was talking about. Any questions I had, he answered.
What exactly did you have done?
His approach was to get rid of the puffiness. I had a lot of excess fat underneath and above my eyelids. And this wasn't about trying to look younger. It was just about looking rested, not tired, not, such deep wrinkles.
Take us through the day of the surgery.
a little nervous, but I couldn't wait to get here and get started. And once again, you know, as soon as I walked in, I felt very comfortable. I felt like I was at home, you know, just doing something that, you know, it's such a big decision to go ahead and do this, especially to the face, but I just felt very comfortable with him and the staff. Everything went well, and I felt great afterwards. You know, everybody was there in the surgery room supporting me. It was fine, and I felt terrific. It was fine.
What about the pain? You say it wasn't that bad?
It wasn't that bad at all, no. I was very nervous that I was going to be in pain, but it was smooth, it was easy. I didn't need any medication. It was really fine.
Let's talk about the recovery process. How was that?
You know, for the first week, I wore sunglasses, which was fine. I was a little swollen, very, very slightly bruised. It was really actually easier than I thought it would be.
And what did you start to notice?
My eyes looked so much smoother, less wrinkles, and not as puffy. Even when I put my makeup on, I could see such a difference. I really don't even need much makeup. Before, I was trying to kind of cover up and it would actually make it worse. So I just, I look well rested. You know, I don't need to do much now. Before, I had to.
The thing is, you don't even look like you've had work done.
Absolutely, and that was important to me. I didn't want to change, you know, the way my eyes look, the shape of my eyes. Dr. Brauman is very natural. He doesn't, you know, he likes to work with what you have and not make major changes, and, you know, it was just a little touch-up.
Do you think you would have gotten the same results if you would have gone to a different surgeon?
No, definitely not. He's a meticulous man, very picky, very, very smart, and he just knows what he's doing. You're in good hands.
Has your life changed since surgery?
Absolutely, my life has changed. I feel more confident. I look better. It shows in my work. You know, because I'm working with people, working with children, you know, I have to be happy. I have to look well rested. And it's definitely changed my life. My family could tell. You know, they see it right away once they look at me. I just feel more confident.
What do they say to you, like, wow, or...
Wow, your eyes look great. You don't really look like you had much work, but yet there's such a change.
Exactly.
Yeah.
Advice to someone who is now watching you on the World of Plastic Surgery.
I think if someone's thinking about plastic surgery, if something is bothering them, they should go have a consultation. That's what it's for. It's so worth it. Dr. Brauman is a great doctor. You will feel so comfortable. Come in for a consultation. Don't wait.
Would you do it again?
Absolutely. I would definitely do it again. Yes. I feel more confident, more at ease, relaxed. I'm just happy, overall happy.
I'm so glad you were watching World of Plastic Surgery.
Me too.
Thank you, Dr. Brauman.
Yes, thank you, Dr. Brauman.
Up next, we'll hear from Carlene's plastic surgeon, Dr. Daniel Brauman, as we find out more about his unique approach to eyelid surgery.
Now I'm convinced, and it's only recently, that there are major advantages to what I do.
We'll be right back right after these before and after photos. Welcome back. Our featured plastic surgeon, Dr. Daniel Brauman, joins us now. Dr. Brauman, nice to see you again.
Good to see you too.
This show we're talking about eyelid surgery. You have a unique way of doing it. Tell us about that.
It's a total different way of thinking about the issue. Because unless you think about it differently, you get the same thing. For me, I had to think about what is it about? Is it about the skin? And the answer is no, it's not about the skin. Is it about the bags? No, it's not about the bags. It's about contouring. And that's the bottom line.
First, tell us about the traditional concept, the way that most doctors are doing it.
Traditionally and usually still, I think for the most part, it's, you see the bags underneath the eyes, and you say, the surgeon says, well, I'll remove the bags. You have problems with your skin, let's tighten it. But neither one of these things achieves anything except make you look worse, because the reason that the skin is not looking good is, in my opinion, because it's stretched out. So that it's not because there's too much skin, is that the skin that's there is just stretched out over the bags and going into the rings underneath. So it's going over a long surface area. So what needs to be done is to allow it to shrink back. So I remove no skin.
So what do you do?
I take the fat that is in the bags and I move it down underneath the rings into the cheek. And that seems to fill up the hollow that is created by the rings underneath the eyes, and also seems to create an uplift because you're giving more fullness to a hollow cheek.
Who is a candidate for this?
Anyone who sees the changes in their eyes. And it's interesting because the bags are there, and for example, and the bags are there and the upper eyelid changes are there. And they're there. Even in children, you can see bags sometimes. And there are families, interestingly enough, where it becomes very prominent. And you can see that the people develop bags in their 20s with all the discolorations and all the, tired look that it sort of conveys. And with lower lids, not so much with upper lids, it's not unusual or unheard of to do low lids on a 20-year-old or someone in their 20s. But for the most part, it's as people get a little older and all the changes of aging and skin and damage and so on go on.
Everyone dreams of a magic cream that can just erase the signs of aging, and somehow that is exactly what you've done.
The better your skin is before, obviously the better it is afterwards. But the changes in the skin are certainly there. It looks as if they've been airbrushed.
It does.
And that is, even if you do nothing else, because there are other things that you can do with the skin. But if you do nothing else and you just restore the contour, the skin improves 100%.
We keep talking about the eyes, but the cheeks have also been improved.
Again, it's a concept. I'm always going back to the same thing. You are really creating the effect of not just creating the effect of, but you're really performing a sort of a cheek lift. And the major thing is that it seems to be a permanent fix. Permanent in the sense that when you're restoring fullness with your own tissues, no fillers, no implants, that makes a huge difference. And then it's a self-maintaining process. I expect it to be there forever because the fat, let's assume the bags get worse. Okay, but they're getting worse in an area where they're needed, underneath the rings, into the cheeks. Yes, I've only seen 9 or 10 year follow-ups so far, but I anticipate that it'll be permanent because of the way that it works.
We just heard from Carlene. She is so happy with her results and she looks fantastic.
Yes, she does actually. It was a big change for her. There's no question about it.
What exactly did you do?
Carlene is a different, slightly different situation, because when you're talking about Carlene, you know, when you look at her before, the major thing that you see is changes in the skin. She doesn't have big bags, she doesn't have big rings, so the contour seems to be more or less okay. So what does one do? I did do the same procedure. In other words, I did contour the lower lids because I knew that that helps the skin, obviously. I'm now able to refine the fat that I take out, like a fat graft, and refine it until it's very, very fluidy and sort of smooth, not like the usual fat graft, and inject it into the lines of the eyelid and the crow's feet. And in order to make it stay, I gave her some Botox before, about a week or so before, and that sort of rested the lower eyelid, that rested the crow's feet, and then when you inject it in, you have a better chance of it staying in there, in those lines, without being squeezed out.
What kind of recovery time can someone expect?
Recovery is a little longer. The procedure takes a little longer, but it's reasonable. And it costs a little bit more because of that. The surgery itself is different. You know, it's not just the eyelids that we're treating here. It's really the entire center of the face. It's, you know, I still call it eyelid surgery.
It's almost a cheek lift too.
It is a cheek lift.
Should someone get work on their upper and lower eyelids at the same time, or do you separate those procedures?
I usually encourage people to have both done at the same time because it balances out everything that you're doing. I mean, there are some who need nothing done to the upper eyelid, and that's fair enough. But most people, you know, if you're talking about aging, that most people age more or less together.
Okay.
Where it becomes a little bit different is the issue of the brow. And I do not like brow lifts, any of them. I think that it's too much surgery for too little gain. You are working against gravity. And when you work against gravity, you usually lose. So the best way to do is to work with it, which is how the lower eyelid procedure works, because I'm not pulling up so much as I'm filling in from above. So that is to me a good idea, and it works, and it will stay. It's really like doing a brow lift from below and not going into the hairline. All I do in the brow is, while I'm there, I stabilize it to where it belongs, where it used to be. If I can achieve something from below, that's big.
Well, what I think is big, all these improvements we're talking about, yet none of these women look like they've had any work done. They look like themselves.
The idea when you're doing surgery for things that happen during the aging process or the sun damage process, you're really, the objective is not to change anyone's look. The objective is to make them look as the way they looked a couple of passport photos before. All I'm trying to do is restore the appearance to what they used to look like before they started aging.
And it's all about the concept.
And it's about the concept.
All right. Thank you very much, Dr. Brauman. We're going to be right back with more from Dr. Brauman as we find out about how doctors from all over the world are coming to Dr. Brauman to learn about his techniques. We'll be right back right after these before and after photos. Welcome back. This eyelid technique that you've developed, Dr. Brauman, it's not the first time that you have improved upon an existing technique. In fact, your tummy tuck technique, that has gotten worldwide attention.
Yes, it has, because I published it and, you know, in the literature, and so it's nice. I mean, it's nice to share. There's one thing that one has to realize about surgery, and that's really an important point. If you're the only one who can do a certain technique or a certain procedure, that's no good, because you may be very good at it and all the rest of it, but a procedure has to be reproducible. In other words, if a technique is good, if a technique is reliable, and it should withstand a lot of different people doing it, and they should be able to reproduce the results. And that is crucial. And that is why you teach it, so that you know your technique is good.
Can you compare your technique of a tummy tuck compared to the traditional one?
It's all an anatomy and an anatomical principle. The principle was that the skin of the abdomen, or the skin everywhere, is attached by blood vessels, nerves, and ligaments to the underlying tissues or bones. So when you are doing liposuction, for example, and removing a layer of fat right near the muscle, you are essentially separating that entire layer of skin and fat from the muscle without damaging its circulation. And then you can move it, because it's already loose and it's already mobile. So that separation or dissection is the important thing that I do. And then you can do a lot more. You can contour the entire torso. You can contour a lot more for the same reason, for the same reason, for the same reason. There's good circulation. So you're not worried about your circulation. You're not worried the skin will die. Again, it's about the concept. It is.
This discovery has gotten a lot of attention from the medical community.
It has. And if you recall, we had already spoken about my going to the Netherlands, and really it sort of built on itself, because the professor of plastic surgery at the Netherlands actually invited me again to, this time to Amsterdam, and invited me, and it was very nice, obviously. And I went with my nurse, and he invited me to demonstrate the surgery on one of his patients, and this is what we did. So, you know, it goes into the closed circuit camera, and the attendees at the conference can see what you're doing, in effect, all the surgeons, and they can learn the technique, essentially watching it. So that went very nicely. And then I invited him to come here to New York, and we taught a course together on this technique at the Javits. And that was really nice, because he presented his experience with my technique, and I presented mine. So it was the European experience and the American experience on the same procedure.
And then we have South American experience. You've
Yes,
had a doctor
yes.
that's come from South America to learn from
Yes,
you.
it was really because one of the people, there are several doctors from South America who were attending the course, and one of them came here from Colombia, actually, and we developed a friendship, because, you know, he's younger, obviously, and he wants to learn various techniques that have been developed, that I've developed. So it's been very nice. And, you know, he obviously speaks fluent Spanish, but he trained in the United States, so he speaks English as well. But I do not speak fluent Spanish, but I do understand a fair amount, because after all, it's a Latin language, and if you know Latin, you know Spanish. And we also have people always in the office, and I now have my medical assistant, Angela, who's from Spain and completely bilingual, so it helps a lot with all our Spanish speaking patients.
Bueno, estoy bien, muy bien. Eleanor, el doctor va a estar con usted en un par de minutos.
So it's really been very nice for us. You know, everything is healing beautifully. You're only 2 weeks after surgery.
You've had patients from all over come to see you.
You know, the nice thing about plastic surgery is that it's a procedure that you do, the recovery usually is limited. In other words, you do not have to come for an extended period of time. So you're going away in what, in a couple of weeks, right?
Yes, I'm going.
Where are you going to?
I'm going to Ecuador.
Ecuador. Okay.
Yes, I'm
Yeah,
going.
that's right.
July
That's where you're
31st. It's no problem at all.
None whatsoever. And therefore, you get it done, and then you can go back home. And then, you know, at some point you come back, hopefully more for me, so that I can see the results. It's really interesting because I've had patients from all the continents, because I've had a few patients from Africa, and then I had a patient from Beijing whose sister I treated here, and then she came in for eyelid surgery, which was really interesting. And do you remember, you know, Ireland and yes, and of course the tri-state area. That's a given. Sometimes Florida, sometimes somewhere else, when people hear about the procedures and they have relatives here.
I think it's you developing a relationship and a friendship in some cases with these patients.
Again and again, you know, I'm really thankful for the fact that I have a very large number of patients who keep coming back and bringing in family and friends. And my favorite line of the moment is, okay, you can bring in your children, but I'm not going to grandchildren. That's it.
Then it's time to retire.
Then it's time to let it go.
Dr. Brauman, thank you so much for joining
you.
us. It's good to see you again.
Thank you.
And we thank you for watching this edition of The World of Plastic Surgery. We'll see you next time.